I met Physicians for Peace in 1997. We organized a big trauma conference in the Philippines. So we invited trauma surgeons from different parts of the world. Physicians for Peace responded by saying they would send me 4 or 5 of their trauma surgeons. So when they came over, we held a conference. These speakers, after their talk, went to Tandag, Surigao del Sur. This is the hometown of our founder, Dr. Johnny Montero. We decided to work together. So the following year when they came, I joined them in their subsequent surgical mission. Physicians for Peace had a different motive. They wanted to teach the surgeons in the countryside to be able to help. So we would raise funds, and the funds we gather we would actually use for our surgical missions in the remote places in the Philippines. I promoted the group to local surgeons who, like me, want to help. So we ended up gaining in number. There were more of us joining the missions. We were doing 2 missions a year, and then we were donating equipment, used equipment from the United States.
Dr. Ted Herbosa, the president of PFP, invited me because at one time he was with Dr. Juan Montero. Dr. Montero, I think, was on his way back to the airport, and as they were passing through Luneta, he saw an amputee hopping his way around the park, and he could not believe himself that a fellow countryman, an amputee for that, could not access an affordable prosthesis.
From here it grew. We had a surgeon that actually came in, and he was an orthopedic surgeon, and talked about a Physicians for Peace project in Turkey, which was about walking free.
Now, the Walking Free program, which initially started with prosthesis, has actually expanded.
We also had the eyeglass bank project, wherein we would distribute used eyeglasses to people that had difficulty of seeing. So we called that project Seeing Clearly. So we're the Walking Free, Seeing Clearly. And our surgical mission was entitled Happy. So that was a hospital assistance program to the Philippine Islands. So the idea is to get more equipment donated to remote areas so more patients could be given surgery. Many of the projects, as you can see, succeeded. We decided, Dr. Montero, we need to get an actual executive director, somebody that will run the office.
Back in 2004, I was invited by Dr. Montero, the founder of Physicians for Peace, to join the Physicians for Peace Philippines family. When I joined Physicians for Peace, they were into surgical missions. Then we started with creation of several programs, program on mobility, the burn care and rehab, the eye care services, which we call Seeing Clearly, which has eventually evolved into coming up with a program on vision screening at school entry. And then we went on. The partnership with UNICEF opened doors for us to go into health policies and research. And now we've been able to develop a package for children with disabilities. And we even went beyond that because UNICEF has been very generous with asking us also to help develop facilities like the one at PGH, which we are very happy and proud to present to the public. And as soon as PhilHealth rolls over the package, It's amazing. We will be touching so many children with disabilities.
In about 2012, 2013, from giving away the prostheses that we used to do, we trained the people to make the prostheses. We set up facilities that would be able to have workshops that can make the prostheses for these patients. We suddenly shifted when we were implementing universal health coverage. We said maybe PhilHealth should be the one to pay for the prosthesis.
We rallied towards developing a PhilHealth package that would reimburse prostheses. And it opened a lot of doors for PFP.
And as we speak tonight, we're actually doing a research on and doing a package for rehabilitation for all those people with disabilities. The programs that we've been able to develop are actually filling the gaps of the local health system. So that alone is an inspiring discovery ever since.
We've done a lot for the resources we have and the people that have really stayed with us. I think for the first 3 or 4 years, there was a different set of people. But the people I have today is basically the same people we've had for 15 years. So I think they're all dedicated. I know they're committed to the causes of Physicians for Peace.
And the success of Physicians for Peace is because we have people like all of you who have been with us for many years, especially our partners in service.